Hello everyone, I am Dr. Rakesh Sringeri, Senior Consultant Gastroenterologist and Hepatologist at Kauvery Hospital, Electronic City, Bangalore. On 19th of May 2023, we observe IBD Day or Inflammatory Bowel Disease Day. I thought I will share some information regarding inflammatory bowel disease. Inflammatory bowel disease consists of two conditions, one ulcerative colitis and the other Crohn's disease. So what happens in inflammatory bowel disease? Usually there is inflammation in the bowel that can start as a redness, which can over the time progress to ulcer formation, and scarring can lead to narrowing of the bowel called stricture. In ulcerative colitis, usually the large bowel is involved, where the inflammation is restricted to large bowel, whereas in Crohn's disease the inflammation can extend anywhere from mouth to the bottom or anus. So the next question is, what causes inflammatory bowel disease? With lot of research, we still do not exactly know the etiology for inflammatory bowel disease, but a lot of theories have been put forward consisting of genetic predisposition or environmental factors like infection or a dysregulated immune system where your body produces antibodies against your bowel, which can cause inflammation. So what symptoms do the patients have? Patient can present with multiple symptoms consisting of abdominal pain, weight loss, loose stools or blood in the stools, or on a blood workup they are found to be anemic. And also the symptoms tend to stay for a longer duration, because usually an infective colitis where some bacterial or viral or some parasites can cause infection, and they tend to be generally self-limiting and the infection doesn't prolong longer. Whereas in IBD, the symptoms persist for weeks to months before they present to a clinician. So how do we investigate? So we start with a basic blood workup, we check for the inflammatory markers. There is a stool test where we can check for presence of inflammation in the bowel called calprotectin, and then we need a colonoscopy where we can directly evaluate the bowel and obtain some samples to study under microscope. Where there is inflammation in the small bowel, sometimes we need help of scans like a CT scan or MRI small bowel. If there is an involvement of the stomach or duodenum, which is a small bowel, sometimes they also need an endoscopy where we evaluate this further. So how do we treat this condition? There are multiple treatment options depending on the patient's symptoms. We can consider anti-inflammatory medication called mesalazine. They come in the tablet form, and sometimes they can also be given through the back passage where they work locally. If the condition is severe, we would need to use steroids so that it can dampen the inflammation quickly with a view to achieve remission. If they are having recurrent episodes, we need to step up the treatment with immunomodulators or biologic therapy, which would achieve better control of inflammation, and it would give a good quality of life for the patient. I would advise, if any patients have a persistent symptoms that I mentioned earlier, should seek a specialist so that they could go through their history and decide appropriate treatment, so that you could institute treatment early and manage the condition appropriately. Thanks.
For appointment, call our toll-free number 180088890009. For more information, log in to our website www.kauveryhospitalsbangalore.com.